So friends, here we are going to start acute inflammation. In this case, we are having like some vascular changes and some kind of cellular changes also. So first we will discuss about vascular change. So in vascular change we have four steps. First is vasoconstriction. Vessel will constrict. Second one is vasodilation. Third one is increase in vascular permeability, and fourth one is blood stasis, decrease in blood flow. And so we are going to start vascular change, and we will discuss this all four steps in details. So friends, in vascular change, whenever any kind of stimulus या any kind of injury या any kind of cell damage will occur, then first change in the blood vessels is going to be vasoconstriction. Means they will decrease the diameter of vessels, and after that some chemicals associated with blood vessels are going to be released, and that they will cause vasodilation. And what are happening inside the vasodilation, our blood vessels will going to increase in size, and so it will cause in at a one place increase in blood volume. So that's why increase in blood volume leads to hyperemia. Hyper means increases, emia means blood. So it will leads to redness, which is one of the cardinal signs we already discussed about. And vasodilation, this vasodilation will leads to increase in vascular permeability. So friends, this increase in vascular permeability we will discuss in details. Like here we have normal blood vessels. Here we have normal blood vessels. In this normal flow of blood is occurring. When any kind of injury will going to be happen, then it will leads to vasodilation and increase in vascular permeability. So in this case, due to vasodilation, endothelial cells, these endothelial cells are going to contract and their size become small. So much more space are present between these endothelial cells. So any kind of fluid, any kind of cell, any kind of protein, they can easily escape out from the blood vessel lumen. So this is also a combination of fluid, cells and protein are called as exudates, and they will cause swelling या edema. Which is also one of the cardinal signs of inflammation. Okay, and exudates are normally absent in normal blood vessels. So friends, endothelial cell contraction is the most common mechanism by which it increases the vascular permeability which is takes place. So in case of endothelial cell contraction, the mainly involvement of arterioles, capillary and venules, most commonly venules. Okay, so during inflammation, so friends, during inflammation more permeability will increase, and it will leads to more permeability will increase, vascular permeability will increase, it will leads to more fluid will leak out, it will cause the more cell to leak out, and it will also leads to more protein to leak out from the blood vessel lumen, and it also cause more number of lymphatic flow also. So we know, so friends, we know if this is blood vessels and exudates are flowing outside, and this is an inflammatory area, and this all exudates are going inside the lymphatics here, inside the lymphatics. So along with this extra fluids which is exudate, sometimes bacteria and toxins also, sometimes bacteria and toxins also can go inside the lymphatics, and it may leads to one disease, we can call it as lymphangitis. The loss of fluid and increased vascular diameter leads to slow the blood flow, and concentration of these red cells in the small vessels and increased viscosity of the bloods that leads to engorgement of small vessels with slowly moving red cells. This is also called as stasis.